everyone. My name is Dr. Namita Pawar and I'm a specialist obstetrics and gynecology at NMC Medical Center, Shahba, Sharjah. And I have experience of over 25 years in the field of obstetrics and gynecology, and I have expertise in treating all sorts of obstetric conditions, for example, diabetes, blood pressure, miscarriages, and gynecology condition, for example, cervical cancer, breast cancer, and so on and so forth. Today we are going to discuss a very important topic in pregnancy, and that is gestational diabetes or diabetes in pregnancy. Gestational diabetes is a condition where in pregnancy, for the first time, it is diagnosed that the patient has high blood sugar or diabetes, and more often than not, it develops during the 24 to the 28 weeks of pregnancy, and at times it can develop earlier also. Well, there are some women who are at risk of gestational diabetes, and these are women who are obese, that is their basal metabolic index or BMI is more than 30, all the women who are more than 40 years of age, also women who have had a history of gestational diabetes in the previous pregnancies, those who have got family history of gestational diabetes, either their parents or their siblings have diabetes, these are at risk. Also, women who have had a history of very big babies, that is we call macrosomia, babies weighing more than 4 kg in the previous pregnancies, they are at risk. Also, if you have heard of a condition called as polycystic ovarian syndrome, that is in itself a condition which puts you at risk for gestational diabetes. Gestational diabetes is very important to discuss and diagnose, as it leads to a lot of maternal and fetal complications. For example, if the mother's blood sugar goes high, it results into a high blood sugar for the baby, and it can lead to miscarriages, it can lead to congenital abnormalities in the baby. Also, the growth can be affected. If the blood sugar is high, the baby can become too big in size, which is called as macrosomia, and that leads to its own complications. For example, difficult delivery of the baby, and also the head delivers and the shoulders get stuck, which is called as shoulder dystocia. And also, because of the big baby, it may lead to a more incidence of cesarean sections, and later on more incidence of bleeding as well. And also for the mother, it's important diabetes should be managed. Why? Because it may lead to conditions, for example, too much water around the baby, which is called as a polyhydramnios. And if the bag of water ruptures, it may lead to preterm labor and more incidence of cesarean section for the mother. Also, later on for the baby, there can be complications post-delivery too. For example, high blood sugar in the mother with high blood sugar in the baby, and later on it may lead to low sugar level, which is called as a hypoglycemia, and lead to problems related to breathing, which is called as a respiratory distress syndrome for the kid. Well, it may happen that most of the gestational diabetes cases may be asymptomatic, so there may not be any symptoms, but yes, at times it may happen that the patient has got more thirst, which is called as a polydipsia, and patient may be feeling more hungry, we call it polyphagia, or increased frequency of urination, that is to urge to pass urine very often. And also sometimes because of the more blood sugar, the patient has a tendency to develop more vaginal infections as well as to develop more urinary tract infections. But more often than not, these cases may be asymptomatic. Yes, it is very important to diagnose gestational diabetes, and this is done by universal screening, which means that all the pregnant ladies should be doing a test which is called as a glucose tolerance test. And this test is done usually at the start of the 24th week of pregnancy. But those who have got, those women who are at risk of gestational diabetes, as I mentioned in the previous part of the interview, and these women should be doing the gestational glucose tolerance test at the start of the pregnancy. And when we do the GTT at the 24 weeks, what do we do? This is a test where the woman has to come fasting. Her fasting blood sample will be taken, and she will be given a sample of glucose juice to be taken. And after she drinks the glucose juice, after 1 hour, after 2 hours, her blood sugars will be taken. And if all the 3 values are above the normal range, she is diagnosed as gestational diabetes and treatment is started. Yeah, so when a woman is diagnosed with gestational diabetes, the first step of management is doing a nutritional management, in which case the patient is advised to take a diabetic diet, which means that she has to avoid the high carbohydrate food or the food which has got a high glycemic index. For example, sugary stuff, for rice, potato, sweet, chocolate, ice cream, anything that gives a spike of her blood sugar. That has to be avoided. She has to take a healthy, well-balanced diet, more rich in protein. For example, egg, fish, chicken, all sorts of vegetable, all nuts, all low-fat cheese, and stuff which does not increase her sugar. So step number 1 is the nutritional management. And most of the cases of gestational diabetes get corrected with the nutritional management alone. And for the rest of the cases, even after 2 weeks of good nutritional management, there is still a spike in the blood sugar, then we shift over to giving them medicines. And in case the medicines do not work, then we shift over to insulin. So that is a gradual step of management of diabetes, and it is important that the patient is told and taught how to do the home glucose monitoring, because it is difficult for the patient to come to the clinic every day. So she is taught how to check her blood sugars, her fasting sugar with a good adequate management, either with diet or with medicines or with insulin, should be less than 100. That should be the target. And after every meal, that is after breakfast and lunch and dinner, her target sugar should be less than 120. So if these values are running normal, then that is best management. So most of the cases of gestational diabetes, once the baby delivers, the diabetes comes back to normal. Why? Because as we know, the logic behind this is that high blood sugar is because there is a problem with the pregnancy hormones which are disturbing the role of insulin. You know, insulin is a hormone that takes care of our blood sugar, that causes the sugar to go inside the cells of the body. So once our pregnancy hormone progesterone is more, the progesterone interferes with the action of insulin and hence the high blood sugar. So once the baby delivers, the placenta delivers, the progesterone level come back to normal and the sugar also comes back to normal. So it reverts back to the normal in most of the patients. But yes, in a few cases, it may lead to it may lead to the diabetes mellitus type 2 in their later life as well. And also for the baby, baby of the mother who has got gestational diabetes have the long-term complication of developing obesity and developing diabetes too. So the take-home message is that gestational diabetes is a very common condition in pregnancy, and one has to be alert and aware. It is not dangerous, nothing to be afraid of, but yes, should be diagnosed correctly. One should be aware what all problems it can lead to, and once diagnosed correctly with the proper lifestyle management, proper nutrition management, medication and injectables, it can be as normal as a normal gestation for the mother, and nothing to be afraid of. And we have tests available, we have a routine management of diabetes available. Anyone who has to have the adequate management and concerns and questions regarding the management of diabetes can come to the clinic. So I hope this discussion was helpful for all of you, and I hope I've been able to answer the common questions related to gestational diabetes. And if you have any further queries, any further questions, you can always contact me. My name is Dr. Namita Pawar. I am working as a specialist obstetrics and gynecology at NMC Shahba, Sharjah.